Thank you very much. I am extremely excited to be here. And a little bit about us, we are Google certified, so we take certification very seriously. I want to make sure that we do everything that Google specifies and trusts. What I'm most proud of is actually my mission, which is to change the dental industry by helping dentists live the life they want through creating amazing new patient experiences. But my job is to help you all understand how new patients work and how you can get in front of new patients in your practice.
So all the information that he had to give was great because it explains more in depth from someone I haven't hired who's trying to convince me of their ideas. It's just someone who is an expert but is giving me advice, which I really appreciate.
So what happens when competition increases? So this has happened in other industries, and this is the danger. This is rice. Now, if I asked any of you, do you want me to get rice from QFC or from Safeway? You probably would say, I don't care, wherever is the lowest price, right? Now, I know this is called a commodity, but the problem is when you have increased competition, consumers and patients don't know that. So this is the danger, potentially, that's happening over time. Basically, patients can quickly and easily look at many choices, right? So patients have a lot of choices, and they can make decisions very quickly. So the patients now have power if they don't like the way they're treated, and we all know that that's bound to happen, that things go wrong and patients have weird experiences. So now they have the power with more choices, and they have the leverage with reviews. So let's talk about what's working in 2015. Now, a little bit about me. I help dental practices grow by acquiring new patients. And for me, like you saw with my nerdy picture in front of Google, I am a data and internet nerd. So I am in the trenches looking at analytics and rankings and ads and data all over the place, seeing exactly what works to actually acquire that patient.
We learned all kinds of good stuff tonight. Just to open my mind to, the option of how new patients come into the office.
Okay.
We're a referral-based business, and so we're not really used to, calling patients from the internet. So it's good education.
There are so many ways that a new patient can find you. So many ways. So how do we know what to focus on? Let's look at the numbers. That's what I say. As a data person and an analytical person, I say let's look at the numbers. When people go to Google, they are literally looking cost for veneers in Bellevue. That's directional. They have that need. That is when you want to be in front of them. It means emergency extraction, Bellevue, open Saturdays. That person searched that. That is somebody you want to be in front of. So obviously you need to rank more or less in the first few. Now, reviews are actually changing that. Because a lot of times a user is more likely to skip the first couple ads or the first couple listings if they see a lot of reviews. And again, maybe consistent with what you're behaving as well. So we see a lot of reviews. Now, this is brand new information. Google believes in the user experience so much, they want to return in their results so much that they're willing to say, basically in the past 30 days, if you don't have a mobile website, if your website is not ready for mobile devices, we won't rank you as good. They're basically saying that right now.
We're so interested in him that we'll probably hire him for our 2 practices. How to, revitalize our websites and how to get on top of the SEO and just a lot of different things. Identify who our target market is for our new patients.
Most people don't want to take action right away. They're surfing, right? But if you can stay in front of them and stay top of mind, then they're much more likely to visit you and actually call you. We've talked about search engines. We've talked about buying ads online. And that's getting in front of people. That's only half the battle. Once they see you, they see who you are, they have to like you enough to actually call you. And this is what all of the marketing companies and all the Joe and Sally's of the world miss out on, is how do you get a patient to actually call you?
And I thought the program today was great. I loved it, got a lot of great ideas. Jake is very, very knowledgeable, and I can't wait to possibly work with him and get with him and see what he can do for our practice.
So you want a website that speaks to the patients in the language that they speak. If I wanted to like find an antique 20 years ago, I would have to go to an antique store or ask somebody. Now, I can, in 5 minutes, research every antique within 500 miles of me. So the answer is, yeah, people can go online and access where all the dentists are. Before, they couldn't. They had to ask somebody, or they had to go to Yellow Pages. It's the only ways, or direct mail or something like that. There wasn't many ways to find you. Now there are, and so you've got to be in more places.
We had a lot of good insights.
The special deal we wouldn't have expected was effective.
Was good too.
So many of them have just sort of a set way of doing things. They're not innovative. They don't listen to the specifics of your practice and what you need and who your patient population is and what our values are and all that stuff. They just have a patent way of doing things. And I just feel like Jacob's way more intuitive and can design things specific to the needs of our practices.